So welcome everyone. I hope everyone is feeling full of energy and we have a few apologies today. Um, so Darren Lloyd received apologies from Darren Lloyd, who's our Associate Director for Information Governance and Patient Safety, and Chris Collis, our Chief Digital Architect. Dave Parsons, therefore, will be the WASPI Code Manager, will present the item 4.2 on information governance assurance report on Darren's behalf, and Sam Lloyd, Executive Director of Operations, will present item 4.6 technical design authority assurance report on behalf of Chris Collis. Our independent member, Marilyn Bryn Jones, is also unable to join us this afternoon, so I'm sure we'll miss her, but we wish her well. And in the interest of time, rather than ask all committees to go around the table and introduce themselves, if I could ask all members of the committee to introduce themselves as they present the first item or ask a question, stroke make a comment. And with that in mind, let's move into the usual reminder on the format of these meetings. So there will be a private session at the end of this meeting where we discuss matters that are not appropriate to share with parties who might be interested but don't have the best interests of the citizens of Wales or the security and of our systems that we always make our first priority. However, a summary of those private discussions will be reported at the next meeting and in the public session, and there will be a bridge set of minutes presented then. Committee papers and the minutes have been uploaded on the Digital Health and Care website for members of the public to access. The meeting will be recorded, and the recording will also be posted on the Digital Health and Care website. And if you are watching the recording, thank you very much for your interest in the business of this committee. We really welcome your interest in our work here. There'll be a short 10-minute break at about 2:10. And finally, the public part of the meeting is scheduled to run till 3:15, with a private session beginning 10 minutes later. So you can all judge me on my ability to tell the time. So with that, I'd like to ask the committee, are there any declarations of interest that you need to make me aware of? No? Excellent. In which case, similarly, are there any matters arising that the committee need to consider today? No. Okay, so let's move on to part 2, the consent agenda. You've all had sight of the minutes of the last meetings, the public and the private abridged. Are there any comments from anyone on the minutes, or can we move to approve them? No. Okay, I'm seeing nodding heads, so we'll move to approve those minutes. The forward work plan has been shared with everyone, so I'm just asking everyone to note that. And the information governance framework, the audit review. So that was received by the Audit and Assurance Committee in October and is here for assurance. And I'd like to comment on how good it was to see that being given a substantial assurance rating. So very positive for us there. And therefore, I'm just going to ask us to note that the IG, or Information Governance Framework Audit Review, was here, and you've all reviewed that for assurance. Excellent. So with that, let's move on to the main agenda, part 3, and the action log. There was one action from the last meeting on the log, which is now complete. So thank you very much for that. And with that, I'm going to turn to Chris Darling, our Director of Corporate Affairs and Board Secretary, to lead a discussion through the Corporate Risk Register which also includes the annual corporate risk trending analysis, after which we'll discuss the risks on the register. Thank you, Chris.
Diolch, Chair, thank you. I'm going to run through the current position. There's 18 corporate risks on the risk register, 7 of which are for the consideration of this committee, as in they are formally assigned to this committee for oversight and scrutiny. Those risks, I'm just going to run through those. There's 3 which we'll consider in the private session, so I won't touch on those in the session. There's 2 which committee members will be very familiar with: information governance related 0263 data functions, and 0320 citizen and stakeholder trust in the use of health and social care data. There's 0300 CANISC, so that's the screening and colposcopy risk, and then the 4th one in the public session is 0336, the audit plus withdrawal of contracts risk, which is included, assigned to this committee. So just going to briefly go through those to start with, Chair. So the CANISC risk is now rated at the lowest risk score that it has been, and as you know, it's been on the risk register for a very long time. Under the exec medical director's direction, this is staying on until the system has been fully decommissioned. So Ridian, I know we're nearly there, and we're probably a month or so away from
end of the year.
There's probably not a lot more to say on that one, Chair. I think you're well cited on where we've been in terms of the mitigation and the future plans. But until fully off, that's going to remain on there as a low risk score. So that's that risk. Just to comment on the 2 information governance risks. These are risks that, although are contained on our risk register, do require partnership working to help to mitigate. The next integrated quality performance and delivery meeting with Welsh Government has got information governance on the agenda on the 3rd of December for colleagues in Welsh Government to update on in terms of where they've got to on the policy side of things. I will just see if Sam or Ridian want to mention, because I know the CSIROs, the Caldecott Guardians and the CSIROs have come together a couple of times now to meet at a national level in terms of information governance and cyber security. Sam or Ridian, do you want to say anything about those meetings?
Yeah, so Sam and I have been jointly chairing the Caldecott Guardians across Wales, and the CSIROs have been in attendance. The current issue is that this group of people are meeting in isolation from the governance. In other words, governance isn't plugged in a way that it is listening to the expertise that sit within that group. That's been escalated. It's been escalated by our CEO through to the DDAP board, that particularly the cyber security, cyber KPIs that have been put together by Mark Edwards and others, which are eminently sensible. I won't discuss them here for obvious reasons, but there is a list of them, and that needs to be visible at a senior operational level within the NHS, so that the resources and attention is appropriately given to it. The data sharing is in a more positive position, probably. It'd be fair to say, with the joint data agreement being signed, but there are caveats within that, and the fact that it's signed doesn't mean that all data will be shared, and therein lies the Achilles heel in the programme. I won't add any more for the moment, Chair.
Thanks, Ridian. And then to note the last one, the audit plus withdrawal of contracts, that risk remains ongoing. There is a working group in place to take forward the solutions. There's a number of work streams. There's a technical work stream, an information governance work stream that are working to address and mitigate that risk. And we're hoping my colleague Lee Mullins will be joining to update on this, but we've not had any success dialing him in yet, so we'll keep trying on that. And I'll just work through a couple of other points on the report. So I just wanted to highlight one of the links from the report is the risk trending analysis, the annual risk trending that we do. And actually, as we look through as a committee, there's one private risk which we'll come to. The other 3 risks that have remained static on the risk register during that reporting period are the 3 that we've just mentioned, the 2 information governance and the 1 audit plus risk. The other thing I wanted to note on the risk trending analysis was just the risks assigned to this committee and to the programmes delivery committee. Over the course of the last 12 months, this committee has seen the highest number of risks assigned to it. To some extent, not a surprise in terms of the committee business covering information governance, cyber, information services, organisational learning, etc. But worth just noting that from an organisational perspective, that's also reflected in the risks assigned by strategic missions, so missions 1 and 2, so providing a platform to enable digital transformation and delivering high quality digital products and services are the 2 areas or the 2 strategic missions that have seen the highest number of risks assigned to them over the course of the last 12 months. I will just go back to the report and just comment on a couple of new risks that have come onto the risk register, not specifically assigned to this committee, but just for the awareness of the committee. One is around new resources requirement and the impact on the plan. We've seen, I think, particularly over the last 6 months or so, a number of new requests come in, both internally and externally across the organisation, that have impacted delivery of the plan. So that's something that we've recognised. And the second one I know Alistair's raised previously is the changes in the political landscape in Wales and the potential implications that could have, both in terms of opportunity and threats for the organisation. I can see Lee's joined, Chair, so I will just loop back to the Audit Plus risk assigned to this committee and just ask if Lee can just give an update from the work that's been done to date. Lee, we've just noted this has been on the committee for just coming up for a year now, this risk, and I know there's ongoing work, but can you just give the current position and future actions?
Yeah, so in terms of the 4 workstream elements of the project, the technical work stream is well advanced. We have a potential solution. The work on that has advanced successfully. We are now waiting upon Optum to provide us with the latest extract from Wales, because the solution's been built on an English test extract. So we are awaiting Optum's timeline for delivering the Welsh data into that channel. The IG work stream is progressing. The DPIA is drafted. Again, we're waiting on Optum to provide us with some technical information on the extract function on their sides, and then we can take that through to the various kind of governance that it needs to get through to sign off the IG elements. Reporting are largely waiting for live data to work on. The big challenge for us is the Optum kind of position at the moment, that the reliance on the third party to provide the extract in a timely fashion. They are yet to provide us with a full timeline, but that's providing us with a significant risk associated with the program. So we are enacting all of our kind of mitigating activities. So we have consulted our existing supplier Informatica about the possibility of a further extension. They are content with that as an option. We're just waiting to finalise some papers internally around that as a decision, but obviously currently investigating all of those options to ensure continuity of service regardless. So that's probably the update at the moment. Like I say, some risks as a result of the engagement with the third-party supplier, but we're looking at how we mitigate them as a matter of urgency.
Thanks, Lee. Chair, that covers everything in terms of the update, so happy to take questions.
Thank you. And Alistair and David both have their hands up. So Alistair, you're first. Thank you.
Thanks, Rowan, and thanks, Chris. Very helpful indeed. I'm very supportive of removing risks that no longer apply. I think that's exactly the right approach. But just in regard to 0350 and 0340, the GP migrations and GP systems, I noticed the public reports coming from England of the threat of GPs closing their doors for a period of time, resisting the imposition of technology on their surgeries. And that seems to range from the app through to online appointments. We don't appear to be assessing Wales as having that risk. And I just was interested in your comments on that, Chris.
Thanks, Alistair. Yeah, I think the GP contract negotiations that Welsh Government hold directly with the LMC nationally covers the use of technology through the contract. So it's probably not for me to comment directly on whether the GP community will or won't have a positive approach to what's put forward. The negotiations are often long and back and forth in terms of where they need to be. I think it's a critical point from an NHS Wales app perspective. We know that we've piloted use of appointment bookings through the app. Some GP practices have done that, and then as a result of some of the learning, stopped doing that. So that is a key GP contract negotiation discussion, I think. I don't know, Rydian might want to comment on that, but that's probably as much as I would say on the matter.
I'll make a comment then. It's complex in terms of the political, contractual and business negotiation between independent contractors and the public sector, despite the fact that they're under the same banner of the NHS. Technically, it's relatively straightforward. It's not within the gift of DHCW to enable or to switch it on. It's the duty of DHCW to enable the functionality that when the decision is made to switch it on, it can be switched on.
Thank you, Rydian. That's very clear and very helpful. And you know, Welsh, the health service in Wales is reports into the Welsh Assembly and elsewhere in England. It's obviously with central government. David, you had a question?
I did, thank you, Rowan. And David Selway, independent board member. It relates to comment that Rydian made earlier in the presentation, but specifically on risk 263, which is the NDR Joint Data Controller Agreement that we have signed, which is great news. But it's described in the risk register as a permissive agreement. Rydian alluded to that in terms of it contains a number of caveats, but then said that the data isn't necessarily flowing as a result. So could we just expand on what the agreement actually does enable us to do, what it doesn't allow us to do, please?
Okay, the agreement is that we, DHCW, can be the joint data controller for information held within the NDR, the CDR. That's what it does, David, right?
Okay.
The second part of that is it doesn't mandate the sharing of information held in secondary care or indeed primary care to put it in the NDR.
Ah, okay. So I suspect it. Sorry, go on.
So the first barrier to overcome was people saying, we're not putting it in the NDR because you aren't a joint data. Yeah. So we've resolved that problem. The caveats are unnecessary and show a lack of understanding, I feel. That would be my professional opinion. But they're acceptable and they've been accepted. Now, now we need policy to direct the health service through whatever mechanisms they have to put data into the NDR.
Okay, so two supplementaries, if I may then. So first, question is how much data is in the NDR? So are we actually getting some data in, or is it we've got the agreement but there's nothing in there to worry about? And then the second question is, this is not entirely what's needed in order to make the NDR program a success and deliver value into the NHS. I know it's probably outside of our control to bring it about, but do we have any sort of view as to how we get to the end game of this, which is data flows routinely into the NDR so that we and the wider organisation can extract value, benefit from that, and reduce patient harm?
Okay, so the answer to the first question is there is some. An example would be design of the Royal College of Paediatricians growth chart that we built via that API. That data goes into the CDR, which is obviously held within the NDR. The second part of your question, in terms of the mechanisms to get information in, are dependent on the cultures and behaviours across the relevant organisations and the directions and policy that are delivered from the centre. My personal view is that if we follow the island method, which is if you are registered to provide healthcare to the citizens of Ireland, you have to share that data. Now that seems pretty black and white to me. You know, I'm a surgeon. I like a bit of black and white. It's either bleeding or it's not bleeding. That's what we should do. Okay. That's not something we can influence it. We are influencing, David. Let me reassure you, right? Collect, store, share is a constant beat of the drum.
Yeah, I'm planning to raise a motion to have that tattooed on the front of Rydian, or get him a parrot, because he spends a lot of time repeating that core mantra. Rydian, a bit of a kind of supplementary to that, which is, you know, our key risk 230, the one on sort of public and stakeholder trust around data. You know, those two things are related for me. And if I look at where that risk was initially, where it is now, and what our target is, you know, it's kind of moved in the wrong way over the recent times. What are the core things that are stopping us doing this? Because it's antithetical to, you know, getting into a position where we have complete, robust, audited data that we can build AI and information systems on, which does seem to be a recurring theme that we hear from a lot of support from Welsh Government.
Rowan, there's a lot of history.
Yeah.
In a meeting such as this, it's
difficult
quite difficult
to comment specifically.
Yeah, because there are key individuals who perhaps if they behaved in a different way, the result would be different. And we see this across a number of national programs. The independent members, particularly on this in this group, will be aware of national programs that have struggled because of behaviours, siloed behaviours. The position should and always be that the patient is at the centre of our thoughts. The patients move. Patients don't care what the postcode is. Patients don't care where the money goes to which health board. Patients care about their treatment. I would say the vast majority of clinicians and most managers are in that position as well. That's not quite reflected in the behaviours, particularly regarding the information flow. Our statutory functions from 2021 don't enable us. They don't provide us with the power and the leverage to make some of the things that should happen, and therefore we're dependent on policy and regulation that comes from the centre.
There is something though about a wider erosion of trust.
So on the erosion, on the issue of trust specifically, it would be my gut feeling that the necessity to have a conversation with the public is unlikely to happen given the political cycle, where we are in the political cycle. And the nervousness around this is probably due to previous experience, particularly over the water in NHS England. Look at care.data, Palantir. The communication, the comms here will be different in Wales. It will be, this is your data within the Welsh architecture, your data within the Welsh architecture that helps your care. Because your data is held within the Welsh architecture, your data could help your village, your valley, your community. We're not selling your data. We're not giving your data away. All of those frequently asked questions need to be addressed. In previous discussions with the CMO, previous CMO, was who should have that discussion with the public? Who does the public trust? I'll leave it to colleagues on the call to decide who they trust more. Is it the surgeon with the knife, or is it the politician with the microphone?
I think, and there's a long history of this topic being the third rail of political careers in the wider UK context. I think there is a recognition outside of Wales that Wales has a different approach and different principles governing how it brings data together in a using different tools to the ones we hear a lot about in the rest of the UK. And I'm just going to say that at a tech bio meeting in the middle of October, one of the experts who was talking about where they saw progress on data and the ability of an area to bring data together in a very safe and anonymized way to enable research was called out to be Wales. And I think it would be nice to have some more of that being heard into the public, even if it's not specific to some of the issues we've just talked about, because I think an absence of communication allows fears to move into the vacuum. So it is a hard thing to control, but it's fundamental, I think, to this business or this organisation being able to maximise the service it provides to the Welsh NHS and the value to the Welsh NHS. So it just struck me when I saw that initial versus current status that it was something of interest. I think sorry, Sam, you were going to come back in on that. So before I move on to my next point, can I invite you to comment or ask a question?
Yeah, thank you, Rowan. I was just going to say that whilst this isn't a cybersecurity risk, there's unavoidably a cybersecurity element to public trust in the NHS holding its data, I think, isn't there? And we've seen, a constant slew of compromises of systems, whether they be NHS systems or supply chain systems, and data is released onto the dark web. And it's only recently been announced from the Synovis attack, I think, that the full data implications of that are now understood. So, the NHS collectively needs to invest in its cyber posture, I think, and make sure that we're not vulnerable to things that we can deal with, and ensure that we've got a consistently applied cyber posture where the system is as closely integrated as it is in Wales.
Yeah, and you're not going to get any argument with that point from any member of this panel, I don't think, unless anyone wants to speak up. No, I think absolutely. I think that's a well-made point, Sam. And the only other comment I really wanted to make on the risk register, almost in the interest of balance, really, was it's really good to see a risk that's a long-standing risk on the risk register hit its target, right? So to see CANISC come through what has been an incredibly difficult process to, guide that transformation to a cancer care system in Wales that now is operating on a current platform, because that makes us all it's a safer and more secure system. So really heartened to see that. So thank you. Does anyone else have any comments on the risk register or the risk trending? No. Okay. In which case, I'm going to thank everyone for the discussion there. And if I could move on to the assurance agenda. First off, Keith, if you would lead us off on the incident review and organisational learning report, please.
Thank you very much, Chair. So I'm Keith Reeves. I'm Service Management Team Manager within Enterprise Service Management. So this is the report for the quarterly report for the IRLG. It has been circulated as part of papers. So what I'll do is I'll just go through some of the key highlights from it. The report itself, it covers Q2. So from the 1st of July through to the 30th of September. So some of the highlights from this are that for reporting, we've had 2 notifications going out, one through an early warning notification in relation to people and organisational development, and the second one, which is part of the an amendment to this report from the previous years, is that we've had 1 incident reported through the NIS directive, taking us to a total of 2 notifications across the year. Of the complaints, concerns and feedback, so 15 complaints in relation to the NHS Wales app and 15 in relation to the Dental Access Portal. Some of these are relating to known issues which are still in the process of being resolved. And then the remainder of the complaints that concerns and feedback that have been received are in relation either to DHCW business or directed to other NHS Wales bodies. And then of the inquiries reached through to our corporate governance team, 99 of those were in relation to the Dental Access Portal and 32 were in relation to DHCW business. So we're looking at the inquiries into the Dental Access Portal and we're looking for common themes from that. On the reviewing front, again, it's been quite a busy quarter. So primarily it's been taken through the technical review route with 7 incident reviews. And then we've had 1 other review, which is part of the shared learning report that I did for the DHCW SHA board. And a summary of those reports, some of the key learnings. So I've picked out a couple of the incidents that we've had. One in relation to a failure of within one of our data centers around the failure of the cooling systems. This is something that we've experienced in the past, so a lot of the learning from this also relates back to that previous incident. So where we've identified improvements, that actually helped to ensure that our response in helping teams stay focused was undertaken sort of efficiently and effectively. There is still some work to be done around this, and there's also some work to be done around things like live environment replication, the identifying and reviewing and enhancing the configurations to ensure that the dependencies are tested to support faster and more reliable service restoration, and also looking at real-time system status checks and potential for automated monitoring and dashboard reporting. The second one that I've brought into the report itself is in relation to the NHS Wales app, and this is something that we've been looking at, and we've had a number of incidents over the course of the last year. So this is just really an extension of some of those incidents, and primarily looking at the categorization of the app itself, how it fits and how it impacts on the business, and also how the impact itself can be measured, because the app is not a simple solution. There may be critical areas, there may be standard areas, so we have to do some work around that. And then also to enable faster resolution during the incidents, it's about making sure that the backups of the configurations are undertaken as part of change implementation. So prior to the implementation of those changes, making sure that we've got backups in place. And a lot of the findings and the learning from the app were around change management. So the other part of this is around highlighting good practice of undertaking learning post-change. And then also finally, the ensuring that we are working with our suppliers and our stakeholders to ensure that they can contact us out of hours and vice versa. For the contributory factors, so again, this was a model that the IRLG has brought in. For Q2 in comparison, there's still a high number of contributory factors related to the technical development and delivery of the services, primarily within sort of the infrastructure, the interfaces, and the applications themselves. There was an increase on the active domain from the previous year and also on the previous quarter. So a lot of this is ensuring that our process is being trained out and that we're also recording the competencies and making sure that they're appropriate for our staff. And then the external domain, there was a slight drop on last year. And primarily this is also around the relationships that we've built up with our suppliers and also with the external health boards, where some of our systems are hosted primarily within the radiology community, which has a number of systems which are locally hosted, but they're national systems. Learning wise, we're very much on top of the compliance around this. So some of the recommendations that we identify through review are added into iPassport as non-compliances. So we then have that process in place, and there's follow-ups to those to ensure that those active non-compliances are being measured and mitigated appropriately. And then the final section, which is just on the improvement, there were a number of improvements that we'd put on hold as a result of the ongoing organisational change. For the service management department itself, a number of the organisational change itself has finished, so we will now be looking at those improvements in line with new structures, with primarily the improvements around major incident management and formation of a major incident management team being sort of front and centre on some of the work that we're doing. So that's pretty much all I wanted to cover off. So are there any questions?
So thank you, Keith, because really nice set of slides in Appendix 1. So David, you have a question.
I do. Thanks, Rowan. Thanks, Keith. I wonder if you could talk a little bit more about the dental access portal issues that have surfaced. Unfortunately, I didn't make the last DGNS meeting because I was away on holiday. But 15 this quarter seems a lot. I know it's only been live for 6 to 9 months or something like that. So can you just give me some flavour of what issues are and whether we've got a spike in this quarter, or is it consistent with last quarter in terms of issues?
So bear with me because I'm just loading up the last quarter as well. And I think that it's actually seen I think it's actually about the same as the last quarter.
Okay.
So I've not had sight of some of those issues, but I don't know if Chris or Laura want to come in to provide a bit more of an update.
Chris, would you like to comment?
Yeah, happy to. So it's the dental access portal, as with our other citizen-facing applications and services, always sees far more in terms of interaction, feedback, inquiries, complaints, etc. We've had an increase in the number of complaints, particularly initially with the dental access portal, relating to some of them relating to issues DHEW can address around errors, etc. Some around when will I get my appointment? Can I have an appointment? So it's probably fair to say there's been a lot of interaction with local health board colleagues who manage the dental contracts and are responsible for the appointment side of thing. I think awareness that because you're on the dental access portal doesn't translate directly into you will have an appointment in a week's time is where a lot of the concerns and feedback is coming from. So there is something around awareness of the public. So we have worked with health boards and they're leading some of the campaigns to raise awareness. We've seen the numbers drop in terms of the concerns and inquiries we're getting relating to that as time goes on. So that's positive, but that's certainly what the initial feedback was.
Yep. Okay. That's helpful. Thanks, Chris and Keith.
And I think that there is a piece of learning coming through very loud and clear on our citizen-facing, solutions, that the expectation setting isn't clear enough to the citizens. They're not, and because it's a digital experience, there's digital in our name, so clearly we are responsible and we must be able to provide and make it happen. And that again is sort of part of that conversation. Sam, you were going to respond to that.
Yeah, thank you, Rowan. Just on that point, we are looking at how we provide a unified support model for all of our citizen-facing services, because we've got, they're increasing, aren't they? So there's the app, obviously, there's the dental access portal, there's the vaccines service, and so on. So we're looking at how we provide a consistent support model over the top of those things that gives people a route where they can get support where they need it, but also makes it clear that we're not the front door to the whole NHS and every question about where's my appointment or where's my test result or whatever. Those are not things that we can address. So it's quite a delicate balancing act, isn't it, to try and get that right. And we're looking at whether we can use sort of chat functionality that we build into products and so on to provide channels that help people get to the right place where they need to. And also conversations with WAST around integration with 111 is something that we're looking at as well. So this is something that is very much a live issue for us.
And I think the fact that we recognise that it's key, it's a live issue for us, B, that it's key to the trend that you're seeing around the world to provide healthcare support to populations through apps, and we see different levels of functionality within those apps around the world. I know we have plans for additional functionality to go into the app. I think cracking this sooner rather than later is clearly something we all want to see, because it then gives us another muscle for which we can support the citizens of Wales. Are there any more comments on Keith's report? No? Well, Keith, thank you very much for an excellent report, and the committee's asked to note that for assurance. And the next one is the Information Governance Assurance Report. So David Parsons from the WASPI Code Manager. David, the floor is yours. Thank you very much.
Thank you, Chair. I'm Dave Parsons. I'm the Wales Accord on the sharing of personal information code manager. As you know, our information governance report is built around a number of aims. These link into our information governance strategy. So I'm just going to spotlight a couple of the main parts of the report that I felt were worth spotlighting today, and then take any questions. In terms of our corporate information governance compliance, aside from the fact that we've had a very good internal audit report, which has spotlighted just a couple of minor areas for us to potentially improve, which we're now working on. We've also, in the past 12 months, undertaken our own information governance toolkit. So as you know, we've got a dual responsibility in relation to the toolkit. We're responsible for developing and the maintenance of the toolkit, but also required to complete that and conduct our own assessment. Earlier in the year, we identified a number of actions which we felt could help improve our compliance further. Our toolkit compliance actually was exceeding expectations. So again, it hit the highest standard that it could. But as always, we're always looking for ways to improve that and provide even further public confidence. Just want to spotlight a couple of the things that we highlighted and where we've improved and done some work to date. So the first of these is around our publication scheme responsibilities. So as you may be aware, as an organisation, we have now signed up to a model publication scheme. We have now committed to publishing information online and have gone live with a publication scheme on our website. We are also looking at further improvements around that. So that includes publication of our access to information requests. So we are currently building that. So that will move further forward and provide even further confidence and transparency to the public. So I think that's really, really positive. We've also done a lot of communication within the organisation over the past 12 months. This has been particularly focused around our information governance responsibilities, so not just carrying out the likes of data protection impact assessments when it comes to new technologies, new ways of processing data, but also around our access to information responsibilities. So that includes how we have to handle any subject access requests, individual rights from individuals, but also our responsibilities and freedom of information. And I think that's an important one, which I'll spotlight in a second. A number of these actions that we've got, 2 of them are now completed. We've got a further 3 actions that we identified that are all on target to be completed either next month or in January. So we felt it was worth spotlighting to committee the good work that's going on internally to further improve our own statutory obligations and compliance. Alongside that, within Appendix A, you'll note the access to information requests. And I think it's quite important to spotlight that because it relates to a conversation that was happening just now around obviously more systems that we deploy and what that could then mean in terms of actually putting more public facing information out there, which allows obviously members of the public to then ask us more access to information requests. And I feel that that's probably represented really well within the trends that you'll see within the report, because as you'll note on the freedom of information requests, there is a trend in analysis of that increasing. So it is important just to note that. What I would say is that our overall compliance remains within the bracket of either good or adequate, in line with the ISO's expectations. So that's, again, a real positive for us as an organisation. But there is an increasing trend in access to information requests that we are receiving. We've already received more in this current financial year than we received in the entire of the last financial year. So I think that's a really important one just for us to spotlight and make sure that we're aware of. In terms of aim 2, so around our data protection impact assessments in particular, so this is where we're providing that organisational compliance around appropriate use of systems. Again, great activity going on there, which is very much what we would expect. There's been 35 data protection impact assessments worked on during the last period. 8 of these are new DPIAs and 16 DPIAs have been signed off during that period. So really good, positive action taking place within that set of responsibilities that we have. Within aim 3, which focuses around our information governance policy, I know we've already talked around one of the actions today on policy and directive, but I just wanted to take the opportunity to reflect upon our information sharing standards, because 2025 has been a significant year for our service in celebrating 20 years of the Wales Accord existing, and we have in the past couple of weeks had a couple of very good, well, they've definitely been very positive events with all of our key partners, particularly one last week where we had the Cabinet Secretary for Economy, Energy and Planning and the Information Commissioner himself for the UK in attendance, providing keynote speeches. It's been a huge, positive, successful story, WASPI, and what we are looking for now is planning for how we manage to take WASPI to the next levels going forward. So what else we can do So there's a real important piece of work that we're currently conducting around what's next for WASPI, what else can it support our partners with, which we're currently working with our Welsh Government colleagues on as well. So I just want to spotlight that work is going on. Also, I can confirm to committee today that the Code of Conduct proposals with the Information Commissioner's Office have been formally submitted into the decision-making processes. So we will have an outcome, a decision of that early in the new year. Obviously, I can't say too much more around that at this stage, but I think it's a real reflection of how much work has been going on in the past 9 months in particular with our ICO colleagues as well. That we've got to this stage, and hopefully we will get a very positive message early in the new year. Alongside that, I would just like to highlight for my team as well that we did receive a Privacy Award last week, where we won the Picasso Europe Privacy Team of the Year Award. Came as a little bit of a surprise, I'm not going to lie, but I think it's absolutely well representative of all of the hard work that has gone on, not just within that service, but within the information governance team as a whole during the last 12 months.
So I'm going to just thank you for that report, Dave. And before we go into questions, I think we'd all like to take the opportunity to just reflect on what two very substantial pieces of absolute leadership in the field around data privacy and secure data sharing. So firstly, I did see the LinkedIn post with Darren looking like Dave, like James Bond, clutching a very large award. So incredibly well done to you. Those things are always pleasant to receive, but I think the potential of achieving a recognised code of conduct for WASPI within the UK ICO is if it happens, Dave, is a massive feather in everyone's cap on the team, and will have lasting impact in our ability to engage with the public and build some of those trust topics that we were talking about earlier. So I hope I'm speaking for everyone. Obviously, if everyone else wants to chip in and say something as well, but please do reflect that back to the team. And I'm sorry I wasn't there to celebrate the anniversary of WASPI with you, but it was all very well deserved. So with that, David, I'm going to turn to you to get back to focus business and ask a question of Dave.
Fine, I will do, but I'd just like to add my comments as well, Dave. Well done to the team on 20 years of WASPI, getting a submission into the ICO, fingers crossed for the new year, and the award that you've just picked up. So well done. I do have a question though. So our data protection officer service, we've had previous updates on that. It seems to be well received by GPs and there's good take up. I noticed in the report it's now been extended out to pharmacies and optometry. I think that's new, but please confirm that. And if it is, well done. And have we got any interest from those sectors in terms of taking up our service?
Yes, thank you very much, David, and thank you very much for the kind words as well. Yes, in terms of the community pharmacy, there's been a significant uptake in that, as we would have mentioned, right. I think in the last report that we brought to committee, and we have now formally launched, following ministerial approval, the Optometry Wales Data Protection Officer Service as well. But that's in its infancy at the minute, but again, a really important part of our service that provides that assurance again within the public services. So it's something which I've got no doubt is going to continue to grow from strength to strength.
Excellent. Okay, and just a supplementary, if I may. So great that we've got that take up. Have we got sufficient resource in the team to expand that if we do get more colleagues coming on board?
Yeah, I think the way in which the service is designed, David, is very much representative of, obviously we've got a service level agreement, so
Yeah.
anything that we're required to do, it kind of, we're delivering it based on the uptake of what people want. So obviously we use the service level agreement money that comes in to make sure that we've got a resource built around it to deliver the service capacity that's required.
Okay, great. Thanks.
If there's no other questions, I have one, Dave, which is on the information governance incidents and complaints. You know, the table provided in Appendix A, you know, that those look like very small numbers, which is very positive, obviously. Have we ever done any analysis about whether that has changed over periods? We've obviously got a fair few years of data. Do you have any feel for that?
I think it was around about a year ago I came to committee, and I think we were reporting no incidents in one of the reports. And I think I had a question from one of the members at the time around what does that represent the true value of what's going on. Over the past 12 months, we've done a big campaign internally around reporting incidents, because you're only as good as what you know. And even the smallest of incidents can actually lead to a bigger one. So it's important that we're aware of things and we can put measures in place to support our staff and protect the organisation. What I would say around them is I think it's really positive that we've got numbers there. I think that's a really positive indication. In terms of incidents, it is worth noting that a couple of those incidents on that report are in respect of failure to comply with our statutory responsibilities of responding to requests. And that kind of works hand in hand with that increase that I talked around as well. And that's something which we've got to manage, because that isn't just a reflection on us as a service around being able to comply with a request. Increases impact every service within the organisation, because we go into those services asking for the information and putting pressure on parts of the organisation then to have to provide us with information, redact information where it's required as well. So there's a knock-on effect. So it's something that we've got to keep an eye on. We are developing as part of our, as I mentioned at the start of the action plans around the IG framework, a toolkit from last year, we are developing internal dashboards at this time as well, which we're hoping are going to go live next month. And some of those are actually built around training analysis. They're built around information request handling as well. So we will be able to start seeing at the touch of a button live data coming through, which I think is equally important, because if you look at training, for example, if we can see that there is a potential drop-off on training compliance, we can then target in to see where that's taking place. Is that as a result of new starters? Is it as a result of individuals training lapsing? We'll be able to target things. So I think these things are all positives.
Yeah, I agree, and I like the fact we've got our eyes across the data and can report it. So I'm very nervous of saying I want to see trend reports, because it then influences people to say, I want something downwards or upwards. What you want to see is there is signal on the end of it, and we're finding evidence if there is an issue and we can address it. So thank you very much. If there's no more on that, thank you very much. We'll note that for assurance, and ask Rachel Powell to present the Information Services Assurance report. Hello, Rachel.
Hello, thank you. So yeah, I'm Rachel Powell, Associate Director for Information, Intelligence and Research, and I'm just going to pull some highlights from the report. But since July, we approved and reviewed 8 assurance quality plans, 4 requests for change and 4 safety case and readiness reports. And that's really to ensure that all products and services that go through that process have the appropriate information review to understand what impact it might have from an information perspective. So we're very much involved in that process. All milestones from the value from data 4.2 portfolio from the IMTP in Q2 have been delivered on time, and we've got confidence that Q3 and Q4 milestones will be delivered in accordance with the schedule and the IMTP as well, and those correspond with the information and analytics strategy as well. So there's good alignment there, but as I say, confidence in delivery and a good progress and track record of delivering those as well. I've previously provided quite a lot of information to the DG&S committee around the Power BI assurance process, and actually I'm just going to refer back to the last committee where we were discussing the risk associated with unintended access to information through the publication of dashboards, and there was a long-standing risk that I was constantly reporting to the committee, because we were doing quite a lot of work both in terms of implementing that process and making sure that any new dashboards are assured and all users who've got permissions to publish go through a robust checklist to make sure that they're doing everything appropriately. But we were also involved in a retrospective audit. So prior to that assurance process being approved and implemented, we went back and we looked at everything that was on the systems to make sure that everything was appropriate and that everything had been published in accordance with that policy and that process. So we've completed that review now, which is really good, and thankfully we've taken that risk off the risk register now. So again, just to refer back to the earlier conversation, we are regularly monitoring and mitigating against those risks and keeping a close eye on them. Or a phase 2 document strategy for all of the clinical directorate, including the information services documents, has been complete. So everything's been reviewed and processed and updated on the iPassport system. So we're making good progress and keeping a close eye on anything that's due for review or needs to be refreshed or updated. And just to pull a couple of examples then from the section in respect of publications, etc. We've been corresponding quite closely with colleagues in NHS England about releasing some of the NHS England APC, so admitted patient care data. It's been lots of back and forth and obviously changes across the board as sometimes we've progressed and then we've been put back a little bit further, but fortunately we've made some gains in that space, and we've managed to get hold of data that we've been trying to access for quite some time. Actually, we've brought that into a data warehouse, we've done the necessary processing, and we're doing some good work in respect of benchmarking as well. That Wales, so health boards across the system have asked us to take a lead on, and having that data really does complete the puzzle in terms of what we can do in respect to benchmark, and so some good progress in that space as well. And then just to remind colleagues that we've given some examples of some of the information and products that have been published, and we continue to update our website in terms of all publications, all new publications, everything that's in development. We're schedule of official stats as well, and the things that coming up as a result of that, and also when you service requests and any requests for data, we make that very visible so colleagues are able to link in with us. And as well as that, we're continually trying to push the feedback mechanisms that we report up to the monthly management board through the monthly performance report. So we're being very open and transparent about the feedback that we get in respect of all the products that we publish and the people that use them and the numbers associated with that. So trying to be very open and transparent about how the service looks and being quite responsive to any feedback that we do get. And I'll pause for any questions there. Thank you.
Thank you, Rachel, for an excellent report. David, do you have a question?
I do. Thank you, Roland. Thanks, Rachel. I noticed in the report one of your new dashboards is to do with falls, which I'm pleased to see. Can you just expand a little bit on how it's going to be used and what we hope potential benefits might flow from it?
Just pulling the report up. Sorry, David.
That's all right.
That's 4.14, Rachel.
Yeah, I've got it. Yeah, so that was part of the 6 Goals programme, wasn't it? So yeah, that we've done quite a lot of work in that space actually, and we also link quite closely with the Value and Health programme to try and work out what the impact of that work will be. So they're doing a lot of follow-up with health boards to see, you know, as a result of this dashboard and this product being available, what impact has it had on your services? You know, how would you like to iterate that in the future? Where's the variation across the system, and does that draw on any particular areas that we need to focus on? So that's part of ongoing work with a lot of where information products, in particular the FORS work as well. And as I say, that the feedback that we're trying to push through a lot of this work is, and it's quite careful in terms of, well, it's quite slow rather in terms of the feedback that we are generating that we're getting back. But as I say, we're being quite responsive. We're trying to be quite proactive and push feedback. So we want to be really cognizant and aware of the, you know, how useful that information is. Is it telling you what you need to do to make improvements to your service provision, or is there further information that we need to go away and consider, or further insight that we need to provide? So hopefully that answers your question some way.
It does. I'd be interested in 6 months' time to understand what feedback we're getting and whether it's. And I speak from a perspective of, I sit on a social housing board as well, and it's one of the things that they are concerned about. And I just wondered if there's a way of using that data to identify things that can be done to try and help people in their homes to avoid falling in the first place and then showing up in a secondary care setting.
Probably the other thing to add then, one of the things that we do, as well as, you know, trying to get that feedback, we link very closely with other service providers. So a lot of the dashboards, which we present at different forum, and when I come on the R&I report, you'll see some of the forum that we present at. We also try and publish a lot of our work through, you know, the official publications, but also publications through the R&I links as well. And the reason behind that is that we want to make sure that it's not just the people who commissioned the initial report, but that they're being utilised in the most appropriate way. So we've spoken previously about the last year of life dashboard as an example, and how actually it wasn't produced for WAST purposes. It was produced, Welsh Ambulance Service. It was produced for palliative care consultants, but actually through dissemination and speaking about that at different events and different conferences and forum, Welsh Ambulance Service colleagues came to us and said, we'd like to work closely with you on that, because we can see from the insights you've provided with regards to last year of life, there's some improvements that we can make to as part of that overall pathway. So similarly with the FORS work, we'd like to think the work that we did to socialise and share the insight and findings from that, hopefully it resonates with different areas of the service, and we can all contribute in terms of the overall improvements.
So Rachel, what you're really also sort of describing to me is the dashboards are almost tools that drive some stakeholder engagement.
Absolutely.
You know, because the falls are an early indicator of frailty or some other risk factor.
Yeah.
And then it you know, and there's a lens obviously that you describe within the health service, but there's also other care services outside of the NHS. You know, David's mentioned social housing organisations that may also have a legitimate reason to use that data, even just at a high level, to guide their insights. So be quite interested to know, kind of take an example dashboard and just see how it's driving some of our engagement. It'd be a very interesting case study to hear about at a subsequent event, a subsequent committee meeting or board development day. Alistair, sorry, you were waiting.
No problem, Rowan, and thank you, Rachel. There's always real value in understanding better the work that you're engaged in, and it's really partly an extension of what David and Rowan have been talking about. A couple of thoughts or questions. It's always great to see what the outcomes are from the work that we do. That might be in terms of productive connectivity with other groups, but it's trying to see that in itself it looks like it's valuable work, but what are the actual outcomes that result from the work that we do? So that those connections, I think, are really, really helpful to understand better. Social services across the country would be a very good connecting point for anything to do with falls, because the adult social care departments of every one of the 22 local authorities, they falls is one of the absolute drivers of the requirement for new assessments for social care, and there's a great work that has gone into prevention in terms of falls. That I'm not sure if you're making those contacts, but it would be probably a very good thing to do. I was going to ask about the. It's great to see the child health reporting has been automated, but it relates to my first point, really, Rachel, and that is, what do we do with that information that is actually productive, that it assists in better development of better health amongst younger people? How do we use that information, may I ask?
I'm just reflecting on the conversations, and I'm thinking, and it's something that we've picked up as part of the research and innovation report, but as the questions are coming in, as we're having the discussion, I think what's going to be useful for coming back to the next committee is almost like an outcomes benefits section to really show who we're engaging with as part of the products and the impact that they're potentially having, and because it's less about, I suppose, from our perspective, we work really closely with clinical leaders, and we're instructed to do work on their behalf, and we need to interpret their requirements. But I think what's important is for this committee, what I'm hearing is you want to hear more about the impact of what the products are having. So yeah, with your permission, what I might do is go away and reshape this a little bit for the next committee to have more of that kind of outcomes and benefits, and I can probably provide a bit more intel in terms of who we're engaging with and what the anticipated benefits are. So I'll look a little bit further into all of the dashboards that we're reporting on.
So I think that's a great observation, Rachel. It might not be across all of them, but I think maybe that idea of spotlighting one or two.
Yeah.
Because I think this is a great forum for also showcasing the benefits of having healthcare data. As Ridian always says, sharing is, share data is about safe care, but also this type of data is improving services as well. So, really pleased to hear about the significant output of what you've been doing over the last quarter. And if there are no more questions, may I suggest that we note your report for assurance? And I look forward to maybe a little evolution of it for the next meeting. So thank you, Rachel. We have a 10-minute comfort break schedule. So if I see you back at, let's say 4:25 to take the last bit of this. Thank you very much. To the continuation of the public session, and I'm going to pick up where we left off with Rachel Powell giving us delivering the Research, Innovation and Knowledge Management Assurance Report. Thank you, Rachel.
Thank you. So again, I'll just pick up some highlights from the report. There was quite a lot to cover off this time actually. Again, all milestones associated with the original Research and Innovation Strategy for 22-25 have all been delivered by the end of Q2. And again, we've got strong confidence in delivery of all Q3 and Q4 milestones within the IMTP. We're also well underway in terms of refreshing our Research and Innovation Strategy for 2026-29. So it's deliberately called a refresh because we're not ripping up the first version and starting from scratch, but it's very much building on the progress of that strategy and the 4 strategic aims that we engaged quite strongly on, but reflecting the position that we're in now and the maturity of the service and how we want to push things even further. So hopefully we'll be able to bring that back for the committee's attention very soon. We've completed the annual Digital Economy Act accreditation as part of a relationship with SAIL as a trusted third-party provider. And whilst we haven't had confirmation of the success of that review, we're feeling quite confident, and everything was submitted on time, and we had good feedback from the assessors from the ONS. So we think we're in a good position. But as I say, as soon as we've got some confirmation of that, we'll provide further information. The e-library annual report has been finalised, and that's available on the website, both in English and Welsh versions. And we've reported previously quite a lot on the work we've been doing in respect of open access, both in terms of the open access policy that we published last year and the open access repository that we procured, and we've been populating with different materials. We've just commenced a feasibility study on behalf of Health and Social Care to look at how we can shift towards more open access publishing as a system-wide approach. So doing quite a bit of work in that space. And actually we're Head of Research and Innovation is going to be speaking at SHA board at forthcoming listening and learning slot. So I'm really looking forward to Rachel sharing all the information that we're doing in that space, because we really are leading the way. And actually, we recently were meeting with colleagues in NHS Scotland who are very keen to work with us to look at what we're doing in Wales to see how they can replicate the approach in Scotland too. So we're happy to lend our support, more expertise in that space. With regards to SAIL, so the Secure Anonymised Information Linkage Database, we've got a long-standing relationship with SAIL colleagues, and we provide the data. A lot of the data into SAIL and the anonymised linkage technique, we developed that, so it's very much part of the fundamentals of the SAIL relationship. We're progressing a new service level agreement with colleagues in SAIL and involving Welsh Government colleagues as well, just to renew a commitment as part of that arrangement, and trying to factor in the change in landscape around health data research and what we can do collectively as a system within Wales, and what our responsibility is to provision SAIL with more data, but also what that looks like from us as a provider of that information, and ensuring that we've got the correct arrangements in place, both from a capacity perspective, but also being very clear on roles and responsibilities, and linking closely with information governance colleagues in terms of, where we aren't the controller of a data set, whose responsibility is to liaise with various services around Wales, etc., to ensure that we've got that data flowing into SAIL. Interestingly, we've also been doing some work, and just referring back to your earlier point, Rowan, around how we can systematically draw the value on a lot of the work that we're doing, and particularly in that research space, I think there's a really important story to tell. So we're working quite closely with various academic institutes, including SAIL colleagues, because they do a lot to kind of track the value of, the SAIL's provisioned. It's funded for, I think, about 35% from Welsh Government, and then it recovers the rest of the funding. But the impact that has on the research environment and the changes that's making, that's all tracked, and we're an important piece in that puzzle. And again, linking it back to the open access repository work, we want to be ensuring that we're very much prominent in that space, and that our contributions kind of called out and reflected, so that we can also articulate the good work that we're doing to enrich that data landscape and the research environment as well. Very quickly, in terms of what the relationship that we have with the Bevan Commission, we provide ongoing support, and have done this year as well, through the Cohort 9 work. We've also got our own Cohort 9 Bevan exemplar who's just about to complete their work on unequal ageing, and they'll be taking and presenting their work at the Senedd in January. So it'll be really good to see the findings of that work. And again, we've scheduled we've provisionally scheduled some time on a forthcoming SHA listening and learning slot to share the findings there, because it was a considerable piece of work. And I know the team have been approached to say that we suspect there'll be some follow-up work as a result of that. So that's really promising. A lot of engagement, which I referred to earlier, because the information side of things and research and innovation work hand in glove, but we do very much see ourselves as insight service. It's not just about producing dashboards and that's our job done. That's only the start of the journey, if you like. So how we socialise and share the insights and learnings and important findings really important to us, and we're very proactive in terms of our engagement agenda and how we can share the findings from the work that we're doing. So we've listed some of the groups and forum that we presented at recently. And then just finally, the eLibrary team have done quite a lot of work in terms of developing an AI policy for research, library and information services in particular, with a particular focus on copyright and again taking a bit of a system leadership position in that. So the eLibrary Service Board came to us and said, can HEW support and lead on this piece of work, because eLibrary services are feeling the pain and we need to respond to that. So we stepped into that space, and following this committee we'll start to socialise and share that more widely. And then very, very finally, we've been very proactive in the space of the assessing the impact of the US administration on biomedical research and associated resources and the impact that that's having, and we link in with colleagues across the border to really assess what we can do in that space and to make sure that we're pushing the right messaging out, so that as far as possible biomedical research work isn't impacted, or we can call upon other resources. And we've mentioned two escalations within the report as well. I wasn't going to go into those in any great detail, but just to say that you know, both incidents were managed quite effectively, and certainly in respect of the AWS outage, the eLibrary team responded quite quickly and enacted the business continuity plan to make sure that we assessed the impact and pushed communications out, etc. So yeah, that was handled quite well in the end, and fortunately there was minimal impact. So I'll pause for that because that's quite a lot of information again.
So that's a very comprehensive report, Rachel, covering a lot of different aspects of what you're covering under the R&I umbrella. Alistair, you have a question.
Thank you, Rowan, and thanks, Rachel. Yeah, really a couple of things. One is that on this one, you're doing exactly what you were talking about doing in the previous one, which is you're very specifically identifying outcomes and the kind of connections, which is, I think, really valuable, because I guess that's where the real value from the work comes. You know, there are those connections, there are the outputs and outcomes that follow. So thank you for that in this report. I was very interested in your reference to the Bevan exemplar on 4.3 of health inequalities in older people. And clearly that's work still in progress, because the final report you describe is still to come. I was very interested in the links that you're highlighting to mental health, and for all sorts of reasons, mental health has climbed up the agenda, you know, to the point where people are probably talking about it over their breakfast cup of tea these days. You know, it ranges from the workplace mental health issues to in school and pupils, where there are tremendous mental health and anxiety issues resulting in you know, a relatively low attendance levels, all-time low attendance levels. So there are a great deal of reasons why that's going to be extremely interesting to see. I was interested that you mentioned that there was only one particular strong correlation, if I've read it correctly, the confidence to self-manage one's own health as having a significant correlation with mental health. There'll be more coming out in the full report, so I'll hold back to look at that. But I imagine that must cover an awful lot of things, because there are clearly a great deal of behavioral traits that link to you know, good mental health or poor mental health, and whether self-management of one's own health is a very broad umbrella. It'll be interesting to see. On the earlier point you made about open access, and that is being shared with social care, could you just expand on that a little bit, please? What in terms of what information are we providing open access? And how are we actually making sure that social services around the country are making best use of it?
Yeah,
thanks, Rachel.
No problem. And just to reiterate, you're going to hear a lot more about this in forthcoming SHA board agendas. So there'll be a much more in-depth kind of presentation, because I appreciate the open access. There's a lot to take in and understand in respect to that. But with regards to social care in particular, the e-library service has done a lot of work in terms of expanding the provision of the resource that we have, not just across NHS Wales e-library services, but in the last couple of years we've pushed that out into social care as well. So all of social care can now access the e-library resources that we have. We've welcomed social care onto the e-library service board, so they very much influence the resources that we procure, and they help to shape a strategy in terms of what they need and how we can support them going forward. We've been heavily involved in training social care staff to utilise those resources, and we work really closely with their senior leaders as well to bring that evidence-based approach into everything that they're doing. So that relationship with social care, certainly in respect of the e-library service, that's working very well, and it's something I'm really proud of. The open access work, then, as I say, it's something that we've pushed quite strongly in the last year within DHCW, but now our e-library service board members are asking, what can you do for Wales in that respect? Because from a DHCW perspective, I'm really pleased to say that we're opening up the access to all of the materials, and we're tagging them. We're making sure that anything that we've got a direct link to in terms of any publications that are out there in the system are open, they're available, they're not locked behind some journals, that you might have to pay for, and all of the associated publishing costs and stuff. We're working with the authors to try and support the journey through from publication to making that available in a more accessible repository. So the work that we're doing with social care and the rest of Wales is very much about how we can move into that open space, so more of that rich evidence that we're generating and that we're part of is available, is accessible, and importantly that it's being used. And we're following that up as well to understand this publication has been accessed, it's being used, it's been referenced in this way. So there's a lot of work happening in that space, but like I say, hopefully you're going to get a really good presentation on that at the next board as well.
You're on mute, Rowan, but I think you're
good
asking
to
me.
hear. Exactly, David next.
Yeah, thank you. Thanks for the report, Rachel. Well then, on the AWS outage and our response to that, I just wonder, having gone through that, have we looked at a sort of Keith approach to, did we learn anything from what we did during that we might do better or differently next time round should it happen again?
I think in respect of the AWS outage, I have to commend the e-library team, because they responded very effectively and very quickly, and they enacted the business continuity plans. And I think the e-library works so well because we have those strong partnership arrangements across Wales and social, with in respect of health and social care. So our stakeholder list is very robust. Everything that we do, as a service provider is on behalf of all of those colleagues. So actually we were able to push communications out quickly. We had a robust and an up-to-date business continuity plan, so we were able to investigate the impact on the resources that we have and provide that information quickly. And unfortunately, in that scenario, the impact was limited because things were up and running within 24 hours anyway. So the impact was fairly small, but it did allow us an opportunity to test the robustness of our business continuity arrangements. And like I say, with regards to e-library, we were probably fortunate that in that scenario, the stakeholder list is very tight and we could push things out effectively.
Okay, thank you.
So I'm enjoying the discussion, but we are going to run over. So Chris and then Sam, please.
Thanks, Chair. Yeah, it was just a question to Rachel about the report notes of progress against the strategy 22 to 25, and this was a new area for us, DHCW, when the strategy was put together, and you're working on the refresh strategy for 26 onwards. Just interested in some of the learning that we've taken to today and how that'll inform the future strategy.
Yeah, thank you, Chris. It's a good point. And like I say, that we've deliberately called it a refresh because we're not starting from scratch. We're 3 years in, and I remember coming to this committee actually and talking about the original strategy. And I think I had individual conversations with members of the committee as well about, you know, how we could look to shape that. The original strategy was very much around establishing ourselves and about putting some much needed process and governance in place. And there was almost a tension between wanting to quickly demonstrate success, but putting things in and making sure we had robust arrangements. And I think we've done things in the right order, but now I think the new strategy definitely needs to reflect that position, that we are 3 years in, we are a lot more mature, we're a lot more confident in that space. We're commissioning our own research now, so predominantly a lot of the work that we do is as a collaborator and as in a partnership arrangement, and that's great. We understand our unique position in the ecosystem, but we are stepping confidently in that space around how we can commission more work and how we can lead research as well. So I think you'll see some of that coming out in the strategy. And then also in that innovation space, what are we doing to cultivate and to promote and to encourage innovation within our own organisation? Hopefully you'll see some of that as well. So yes, it will look like an exciting kind of vision for how we're going to push the research and innovation service even further.
That's good to hear, Rachel. Sam?
Thank you. Just to comment briefly on David's question about the AWS outage. I think, you know, we've seen a number of these recently. We had that one. There was an Azure front door outage recently as well. And I think as we're about to embark on a cloud migration program, it's really important that we maintain a multi-cloud posture and that we manage our reliance on individual hyperscalers as best we can. You know, I think the digital inflation challenges we've got, the geopolitical challenges we've got, all of these things mean that we have to be really conscious in our adoption of these technologies. We can't get away from it, but we've got to try and manage that risk somehow.
Yeah, I think that's a good point. Thank you, Sam. And Rachel, I'm just going to comment on the 5.1 point around hallucinating references. My team did an exercise recently for a report they were producing where they tried to use AI. And I think something like 65% of the references that came back were bogus.
Wow.
So I do think there is something about quality that we might want to have a conversation with procurement about right now. It's just something to note. Thank you very much for your report, Rachel. Great report, and the committee will note that for assurance. Thank you. And with that, I'm going to ask Jamie Manning to present the Wales Informatics Assurance Group report. Thank you, Jamie.
Thank you. Afternoon, committee. Afternoon, chair. So I'm Jamie Manning, Quality Assurance and Regulatory Compliance Manager at DHCW. So first, an update on the WIAG process itself. So as you're aware, we're moving away from the traditional assurance quality plans and safety case and readiness reports, transitioning to the WIAG Power App, and soon looking to progress requests for change via the app as well. So we have a one-stop shop for all the activities. And also having a digital process offers the ability for data collection that can be used to drive improvement and set KPIs, etc. But essentially, the aim of the app is to make sure assurance faster and more efficient, removing pauses between assurance stages, enabling both requirement gathering and approval within a single simplified workflow. And as the Power App's been running for a number of months now, we gained executive sponsorship to run a Kaizen event, which is a short, intensive team-based workshop focused on implementing significant improvements to specific processes or problems. But ultimately, the goal is to try and reduce as much waste and enhance quality by analysing the process, exploring solutions, and implementing changes. So the event was broken down into 2 workshops. They've actually been completed, so we're waiting on the outcome report that will be shared with Ridian and the Wire Group before acting on any proposed improvements or changes. And at present, 24 projects are actively progressing through the app, covering a broad range of national programs at the moment. On internal governance, Wire continues to provide our monthly reporting to the Integrated Management Systems Assurance Group, the IMS, and the Quality and Regulatory Group. These updates cover assurance lead attendance, submitted plans, changes to process, and any specific developments in the projects if needed. Regarding Go Live compliance, the group continues to receive assurance quality plans and safety case and readiness reports for projects seeking assurance prior to launching the app, and obviously now Power App submissions, so these still remain the core routes for reporting readiness and assurance maturity. There's no key risks or issues for escalation this quarter, which is good. WAG is operating with potential improvements to be made on behalf of all stakeholders, and project assurance is progressing as planned, with no programs or projects going live prior to gaining full WAG approval via the app. In terms of changes, obviously from August this year, operational management of WIAG has transferred to myself, chairing on behalf of Ridian. And just looking ahead, we've had quite a few projects that have requested to come to WIAG in the next reporting period, and this is reflecting an increase as we experience peaks and troughs of digital developments requiring proportional assurance. So thank you, that covers the Wales Informatics Assurance Group report. Are there any questions?
So thank you, Jamie. That was an excellent delivery across a very nice slide set that you provided to committee as an appendix. So thank you for that. Are there any questions? I mean, my comment, Jamie, is that oh, sorry, Ridian, thank you. Oh.
I've got a comment. I want to thank Jamie for being so efficient, actually, both with the introduction of the app and herding the cats. I'm sure he's got a different saying for that, but it requires someone to push the process, and he's doing an excellent job. So formally recognise that. Thank you, Jamie.
Thank you.
Yeah, so if we could note that in the minutes, Julie, that would be great. And Ridian, you were right on my mind, because the observation that I had was clearly the Power BI app is allowing us to run across multiple different projects. There's a very extensive list in the presentation. And as we move to a more agile development within DHCW, I suspect there are more iterations and aspects of what we're doing that may hinge on that. So really great to see you creating that capacity for assurance without reducing any stringency in what we're doing, but keeping pace with the agile development. We're doing more agile assurance, and yeah, nice job.
Thank you.
Any other comments, questions for Jamie? No, okay. In which case, Sam, if I could ask you to present the. Sorry, before I do that, can I just formally suggest that the committee is asked to note the previous report for assurance before inviting Sam Lloyd to present the Technical Design Authority report. Thank you.
Thank you, Chair. So the Technical Design Authority is the body that exists to essentially promote architectural standardisation across DHCW. I think this is particularly important in a time such as this, where we have a lot of changes afoot. So there's a lot of changes to our technology architecture in flight. So Cloud Migration Programme, the NDR, the replacement of the integration hub, the modernisation of some of our user clinician facing tools, etc. Plus we've got operating model transition underway as well, which affects ways of working, which then has a knock-on effect to the way in which we build and produce our product. So the work of the TDA has never been more important, I think. The group is focused on defining principles, standards and blueprints, which are then adopted by product teams when they come to build and deploy their products. good architecture, I think, is always about outcomes. So the purpose of that is really to make it quick and easy for product teams to do the right thing, and perhaps more difficult for them to do the wrong thing. So the TDA works by establishing working groups, which then build those principal standards and blueprints in particular architectural domains, and they then bring those back to the Technical Design Authority for approval. And then individual product designs are assured against those standards through the Technical Design Authority Assurance Group, which is a subgroup of the TDA itself. Since the last DGNS meeting, there's a number of developments which the TDA has overseen. So as part of our commitment to working in the open, we now have a public-facing site where we publish the principles and TDA decisions. So we think that's really important to promote openness and to make it, make what we're doing visible and shareable as widely as possible. We have published and agreed a set of principles in the digital products and software engineering space. So this is overseeing how our systems are built and the specific DevOps processes and so on that we use to make sure that we do that quickly and efficiently and in repeatable, standardized ways. We've also approved a set of user-centered design principles, and we have a practice which has recently been established in this space. So really important that we have standardized approaches to UCD, and this is an area where we know we need to be better as an organization. So it's one where we're applying a lot of focus at the moment. One of the first things that we did as a TDA was to establish a set of overarching architecture principles or enterprise architecture principles. So these are the very top level statements which we aim to adhere to, and the hope was always that those would be adopted nationally once we have a national architecture board in place. We haven't got that board just yet, but through the National Target Architecture project, we have convened a national architecture practice, and that practice has been considering those overarching enterprise architecture principles. And we think they're very close to being ready for national adoption. So hopefully once the national board is in place, it should be relatively a formality to get those approved. We also reviewed a draft set of clinical principles, and actually once we got into those, we thought that they were just principles rather than clinical principles. So we've actually woven those through the other sets of principles that we've already defined. So we now have a complete set of top-level architecture principles across all of the domains that we've established through the TDA. So I think that's really good, positive progress. And we've also we've also started to use the architecture decision records, which is the formal means that we use of defining a decision that we make and publishing it. So the first one of those that we're building is around the cloud decision framework. So how do we decide which cloud provider we use for a given workload? Touching on the comments I made earlier about we need to be really careful about where we put these things, and we need to do this with our eyes open. So we're establishing a framework to help us make those decisions. And then the final point is just to reiterate that we still don't have that national governance for architecture currently, and we think that's a gap. We are working with Welsh Government. There is a data standards and architecture board, which is in the draft governance, which is in the process of being implemented, but it doesn't exist yet. So there is still a gap in that space.
So Sam, I absolutely recognise this kind of lack of governance in the gaps, if you like, between the individual organisations in the Welsh in the Welsh NHS and then something that's coherent nationally that actually goes up, down, agreed, crossed, and back down again, if you like. I have a question. Okay, David, why don't you go first, and I'll save mine.
Thanks, Ron. Thanks, Sam. As always, a lot of great work being done in this space, which is great to see. So please thank Chris and the team and yourself for all the good work that's been done. Just on the topic of the national governance thing, I note in your report that the DDAT Standards and Architecture Group is in the process of being formed. The inaugural meeting, I don't think it's taken place because you said it's the report reads as if it hasn't happened. I guess it hasn't happened in the intervening time. Is there the possibility of this group doing what you needed to do, and have we got any influence on the terms of reference for the group?
Yes, I think so. There's been, excuse me, there's been a lot of engagement with Welsh Government over the last probably year or so about this. So we have agreed in principle that there will be the, in essence, an architecture board that sits nationally and then oversees the work of a series of individual technical design authorities in each organisation. We know who's going to be chairing the new board as well, and conversations are being had with him around that. So, plus we have shared terms of reference with Welsh Government. So I think there is a fairly high degree of confidence that we will be moving in the right direction with that board. Also, we've had Welsh Government representation on the DHCW TDA as well, with a view to kind of, using that as a test bed effectively, and then scaling that up for national use.
Right. Okay. Is there a date for that inaugural meeting?
Not that I'm aware of, David, at this point.
Okay. Thanks.
Do we even have a time scale by which the various bodies want to have that first meeting by? So not necessarily a good date, but is it Q1? No.
No, there's no visible delivery timelines on any of the substructures below the DDAP board, which has met 3 times. Thank you.
Okay. That's helpful to know. Okay, I'm going to move it slightly, Sam. So one of the things that really resonated for me was the idea that you had clinical principles that just became principles, right? And so, although the architecture is separate to NDR, for example, the architecture has to allow for data to move around the system. How are those things reconciled within the architecture? Is there any kind of, is one of the clinical standards, for example, collect, store and share? Because architecturally that allows us to, whatever we're doing, build safer care systems.
Yes, I mean, not quite in so many words as collect, store, share, but yes, the essential data principles.
That's only
3. Yeah, I mean, that principle is woven through everything that we're trying to do through the TDA. It's all about creating open data standards and making it as easy as possible for data to be ingested and for organizations to connect into the national systems in order to do that. So the open APIs and integration layers kind of was actually the first area that we focused on when we started designing principles. So that's really the foundation of everything that we're trying to achieve, I think, through the TDA. You're on mute, Rowan.
Because circling to the top of this committee meeting discussion, with the signed data agreement, which makes us a joint data controller of certain data, then if we can land this as a national architecture and everyone buys into the architecture, it just becomes more and more almost by design that data will flow to where it needs to go. So I think this is so important. It's also obviously part of one of the requirements for us to get out of enhanced monitoring. So we're obviously keen to get that some visibility to the architecture board underneath DDAT as soon as possible.
Yeah, and in addition to the work of the TDA, we've got programs of work underway within DHCW to bring about those things. So there's an API strategy which we're in the process of developing. There's an exemplar set of APIs that we're building. There's the integration hub work which we're doing to modernize the sort of mesh of integrations between systems, all of which are designed to bring that about, really, to make it as easy as possible for people to share their data into the national repositories.
Excellent. And of course, it will all be secure by design, which will also help.
Well,
Does anybody have any further comments, questions, or observations on Sam's report? In which case, thank you for the report, Sam. I'm going to suggest that we note the report and we're assured on the substance of it. And the committee is very keen to see progress on the establishment of a National Architecture Board under the DDAP framework, and looks forward to an update at a subsequent committee meeting is probably what I'd like to see in the minutes, if I may lead the witness on that. With that, if I can move to closing matters on the public session of the committee. I think that we have captured most of the content that we wanted to highlight in the highlight report to the board. There has been some excellent work presented this afternoon. Obviously, do want to make sure the board has visibility on the WASPI path to being application to be a code of conduct with the ICO and their prize-winning endeavours. Is there any other item that perhaps we haven't captured that maybe I should ask for Julie to capture in the highlight report to the board? No. Okay, that's good. Any other urgent business? No. Very good. And then, okay, well, the date of the next meeting, I'm going to wish you all happy Christmas and a great new year, because we don't meet again until Thursday the 5th of March. In fact, happy St. David's Day. That's how far away it is. And note that Chris, some guidance. We are due to start the next meeting at 25 past the hour. That's almost 20 minutes away. Do you want to start at 15:15?
Yeah, I think
if everyone's happy, can we come back at 3:15 and we'll get into the private session. Thank you very much, everyone.